Hello people, welcome to my channel Physio Guide by Divya. So today I am going to explain detail about subacromial bursitis, definition, clinical features, causes, radiography, management, 3 types. Okay. Now let's get into our video. So in previous video I have explained you the definition of subacromial bursitis. Now again once take a look at it. Subacromial bursitis. Sub means below. In this diagram, see, this is the acromial process, this is the clavicle, beneath this the bursa, this is the bursa. So if this bursa will get inflamed, bursitis means inflammation of bursa. And subacromial means beneath the acromial process, inflammation of bursa, then this process is known as the subacromial bursitis. Now we'll read the definition. Subacromial bursitis results from inflammation of bursa. Bursa means a sac of tissue present under acromial process of shoulder, usually by repetitive overhead activities or trauma. By this condition we will get this subacromial bursitis. And in other way also we can write this definition as subacromial bursa is situated beneath the acromial process and get inflamed during the affliction of the neighboring structures of shoulder joint. So affliction means due to pressure on the neighboring means beside structures, there will be suppression or any of this bursa. Okay. Now clinical features means mainly what patient complains. They'll complain pain. This is the main point. No? Pain. When they'll get pain while doing abduction. Means away from the body, while doing flexion away from the body, they'll feel pain. Abduction and internal rotation. While doing abduction and while doing internal rotation, they'll experience more pain, and this, if not treated properly, the movement will be restricted. Okay. Now we'll see here. Patient experience pain during abduction and internal rotation of shoulder and limitation of movement. Delayed pain is often worse. Limitation of movement if delayed. Okay, and it's often worse means pain will increase at night and while doing repetitive work. Now causes. Causes means mainly what we understand by this bursitis. What we understand as a doctor, mainly while they get subacromial bursitis means while doing overhead activities, while doing more lifting, pulling work, while doing more work they'll get this problem. And any accident cases, injury at that position lead to bursitis, and by any infection also. So bursitis, see, first point we can write this. While doing overhead, repetition of certain motions means the pressure will form at that area, and by this condition will arise. And by inflamed joints like in arthritis and gout conditions also, if all joints will get affected, so but this joint bursitis will also get affected. And trauma and accident and injury cases. Now bursa can be classified as aseptic, and septic means it related to any bacterial infection. Okay. Now in this some professionals also are more prone to it, like who do lifting and pulling jobs, and painters. Their work is what, while do more with the hand only. No. So in painters also we see commonly this condition. Radiography means while seeing X-ray we can rule out this condition, where what is the problem beneath the bursa and the acromial process. Beneath the acromial process, what is the condition we can rule out. Now treatment. Treatment means, as usual, there are 3 types. conservative. First, by taking analgesics, tablets, steroids, TENS, ultrasound, immobilization means starting with no movement, no mobilization with sling also. Firstly with gradually after that immobilization, if pain reduces, then we can suggest the mobilization of the shoulder is done by relaxed passive movements and resistive exercises are mentioned. Surgical, if this condition, if physiotherapy condition also fails, we can next go for surgical treatment, like excision means removal of the bursa is carried out in extractable cases. Okay, so this is the once take a complete look at it. Drawing diagram also helps you more. So thank you for watching my video.